Hello students, you are most welcome to this study session of your course NSC 208, that is cellular pathology. This is session 6 and we are going to discuss on inflammation and infection. Inflammation and infection. Let me state that when something harmful or irritating affects a part of our body, there is biological response trying to remove it. The signs and symptoms of inflammation, basically acute one, shows that the body is trying to heal itself. Inflammation does not mean infection. Even when an infection causes inflammation, infection is caused by a bacterium, virus, fungus, or other form of bacteria or microbial life. Whereas inflammation is the body's response to that infection. In this study session, we've introduced the definition, causes, cardinal signs, types and comparison of inflammation and infection. Students, when you are through with this study session, this will be able to explain the definition, explain causes, types and cardinal signs of inflammation, to describe the stages of inflammation and discuss type of infection with comparison to inflammation. Also, we will start by discussing what inflammation stands for. This word is a Latin word. It comes or is coined from a word called inflammo, meaning I set alight or I ignite. I ignite. It means a fundamental process which consists of dynamic complex of physiologically apparent cytologic changes. It involves reaction of tissues to a foreign agent. It involves response to an injury or abnormal stimulation caused by physical, chemical, biological agents, including local reaction and resulting morphologic changes. Destruction or removal of the injurious material and response that lead to repair and healing are all products of inflammation. When any of these agents infects the body, reaction to this infection and the removal from the body of those injurious agents are products of inflammation. Causes could be burn injury, like you could see on this diagram. Burn injury, chemical irritation, that is when you have chemical on your body, it can irritate your body. You have frostbite, toxin, which is poison, infection by pathogens, physical injury, blunt or penetrating, immune reaction, that is due to autoimmune diseases, ionizing radiation, foreign bodies, including splinters, death and debris, stress, trauma, and alcohol, all are shown in this diagram. We now look at types of inflammation. This could be acute or it could be chronic. When you say acute inflammation, it starts rapidly and quickly becomes severe. Some symptoms are only present for a few days, but in some cases may persist for a week or few weeks. Example of diseases which result in acute inflammation include acute bronchitis, infected ingrown toenail, sore throat from cold or flu, a scratch or cut on the skin. You may talk of chronic inflammation, which means long-term inflammation, which can last for several months and even years. It can result from failure to eliminate whatever was causing an acute inflammation, which means acute can progress into chronic when those that causes inflammation in the acute phase were not removed from the body. They will start causing progressive destruction onto the body tissues. We also have autoimmune response, like we have said, to self-antigen. The immune attack healthy tissues, mistaking them for harmful pathogens. A chronic irritant of low intensity that persists. Example of chronic inflammation may include chronic asthma, chronic peptic ulcer, tuberculosis, and rheumatoid arthritis. Now, let's look at the cardinal signs of inflammation. Most of these signs are coined from Latin name, and they are present based on the reaction of the tissue to that foreign antigen that invades the body. Dolor means pain, and due to release of chemicals that stimulate nerve endings. That is the reason for pain in inflammation. We have calor. Calor has to do with heat. You know calories, when you talk of calorie nutrition, you talk of anabolism, the heat generation. So calor means heat. And heat is produced due to increased blood flow to that inflamed site. You always have swelling, which is caused by accumulation of fluid in that area. That one is called tumor. That is swelling. You have rubor, which is redness due to increased blood flow at body core temperature to the inflamed site. You have fontio. Fontio lacer means loss of function because an inflamed organ will lose its statutory function. We look at stages of inflammation. There are 5 stages of inflammation succeeding themselves, and they are incubation stage, the time between exposure to infectious disease and the development. We start showing signs and symptoms. This stage, morbid matter, poisons, microorganisms and other agents of inflammation gather, concentrate in certain parts and organs of the body. You talk of aggravation. During this period, the battle between phagocytes, that is body defense, and nature's antocin on one hand, and poison produced by microorganisms on the other hand, gradually progresses, accompanied by a corresponding increase of fever and inflammation until it reaches the climax, marked by the greatest intensity of feverish symptom. The situation will now come up, a battle between the forces of disease and the healing forces, accompanied by the disintegration of tissue due to accumulation of exudate to pus formation. Apart from that, you talk of destruction stage as that. You now look at the stage of abatement. While at the battle line, you will see that the microorganism and the phagocytes of the body, they have fought. Phagocytes have died, microbes have died. So there will be a serious absorption or elimination of this exudate caused by the death of the microorganisms and the phagocytes. Then there will be a stage of reconstruction when the destroyed tissues will now be cleared from the system and there will be rebuilding of the injured parts, which begins after there is abatement whereby emission of exudate and pus will take place during the period of abatement. Now, we now go to the area of infection. When you say infection, it means infection of the host organism body or tissue by disease-causing organism, their multiplication, and the reaction of all tissue to this organism and the toxin they produce. When you say infection, it tells you infection of the body tissue by organic microorganism, reaction of tissues to this infection, and toxin they produce. Infectious disease, also known as transmissible disease or communicable diseases, comprise clinically evident illness which shows signs and symptoms of diseases resulting from the infection. Presence and outgrowth of organic biological agents in an individual host organism. Infections are caused by infectious agents such as virus, bacteria, or other microorganisms, and this makes it different from inflammation, which are caused by some other that are not microorganisms in nature. What causes infection? Infections are caused by tiny living organisms that we refer to as microorganisms that could not be seen with our naked eyes or unaided eyes, but could be seen with the aid of microscope. When they get into the body and start multiplying, some of these organisms are harmless and help our bodies work properly, but others cause disease. Those that cause disease bring about infection. If this infection is not treated, it may end up causing serious health problems. Some infections are life-threatening, particularly if you have low resistance to infection from cancer treatment or other form of immunosuppression. Now look at the way we can classify infection. Classifying them based on organisms that cause this infection. You have bacterial infection, viral infection, fungal infection, protozoal infection. They are classified based on organisms that cause this infection. Students, you have learned much about infection and inflammation in this study session. By the time we meet next time, we are going to discuss more interesting topic on SS6 cellular pathology. Until then, I want to give you thank you and God bless you for listening.